Welcome back to KTN Prime. Thank you for staying with us. The chairman of the Council of Governors, Peter Munya, is accusing the Ministry of Health of insincerity over the controversial lease of cancer diagnostic machines to the counties. Speaking to KTN's Aaron Ocheng, Munya, however, did maintain that challenges currently faced by the counties are mere teething problems that will eventually lead to the success of devolution in Kenya.
Governor Peter Munya, first of all, congratulations on your election as the chair of the Council of Governors. Will it be difficult for you to fill the shoes of your predecessor?
Well, I don't think so, because Isaac Ruto was the team leader, so we've been working with him. Even when he was chairman, he wasn't working alone. I'm one of the people who was working very closely with him, especially on legal matters, having been the chairman of the Legal Affairs Committee. So he did a great job. Our intention is really to build on the work started by Isaac Ruto.
2.5 years later, would you say devolution is in progress?
We've come from far. I think looking back 2 years, counties have done well. Compare the challenges. I know sometimes people talk about the challenges that are existing, like in the health sector, and they say counties are not doing well. Compare what a government that has been there for 50 years, still having challenges. Not just in healthcare. They have challenges in healthcare, they have challenges in infrastructure. Compare that with a baby that is only 2.5 years old. I think counties are doing well.
Speaking of health devolution, what made the governors change their hard stance in terms of accepting the hiring of the cancer diagnosis machine?
The real truth is that we didn't change our stance. We've been saying from the very beginning we were not opposed to the managed equipment scheme. We only required certain issues clarified and certain challenges in the implementation also clarified. Then when we evaluated the situation and listened to what the public was saying, because of also propaganda was being spread around that county governments don't want their citizens to benefit from good health care, we thought it was in the best interest of the public, whom we serve, for us to sign the MOUs as a sign of goodwill. And then on the basis of that, we can invite the government for a discussion on the other pertinent issues that are still affecting the project. Our calculations are that it is possible to buy those machines in 3 years than leasing them and paying colossal sums of money, that 18 billion in 7 years, and still you don't own the machines. So our first disagreement over the project was it was too expensive.
Some quarters allege that health has become a difficult issue in the counties and it should be taken back by the national government. What is your view on that?
Yes, we've had those voices of people who are very skeptical in terms of the ability of counties to run health. But if you look at the situation the health sector was in before counties came in, the health sector has been improving. It has been improving compared to the situation before devolution, when you could not find medicine in health centers. People are only going there, they are given prescriptions, and then they are sent to the private clinics to buy health care. County governments have streamlined the health sector in a big way. In fact, some of the machines we are being told will be hired, many counties have hired. Meru is one of them that has hired most of those machines, has bought actually and installed most of these machines. Nyeri has bought and installed. Kisii has bought and installed. So this is story that healthcare should be taken back to the government is not based on the reality on the ground. The other stakeholder who has been making a lot of exaggeration on the status of healthcare is the national government, because the national government wants to decentralize. We have a government that does not believe in devolution. And I would want to say that with a very straight face. Many of the challenges we have been facing as counties is because the national government is not providing the conducive environment for devolution to take root. Blame game all the time, uneasy relationship, a very hostile environment that the national government has provided that has actually made the situation very difficult in entrenching devolution. Look at the resources they are giving. look at the money that is still being left in the national ministries to deal with county functions. It's a clear indication they are not very comfortable with the involved system of government, and we know there has been, from day one, there has been a plan to take back, especially level 5 hospitals, back to the national government. And therefore, the idea that counties are not doing well in health, therefore take it to the national government, is not bound by the facts, and it is not realistic, and it can't happen anyway, because devolving devolution of our function is a constitutional process which was concluded, and there is no way you can turn it back. If you want to take back a function, you require a referendum. That's what the Constitution says. So you can't turn it back through a legislation like they are trying to do, because I'm told there is a bill, an old bill now pending in the National Assembly, whose intention is to take back, to clone back some of the functions in health. It can't happen.
Thank you very much.
Thank you.